I'm Dr. Ryan Stanton, and it's time to find out what's going around. This week, and actually over the past few weeks, we've been seeing a spike in a type of meningitis. Meningitis is an infection or inflammation of the lining around the brain. The two most common categories of meningitis are viral meningitis and bacterial meningitis. Viral meningitis is by far the most common and is seen when some of the more common viruses we see spread into the brain and tissues. Viral meningitis is rarely dangerous or deadly, though it can be in very rare cases. Bacterial meningitis is much less common but more concerning and much more likely to result in complications and death if not diagnosed and treated promptly. I talked with a local infectious disease specialist who reports the most common source recently has been the enterovirus, which is a common cause for upper respiratory infections, colds, and other viral infections. The key is early recognition and diagnosis. Common symptoms you may experience are headache, neck stiffness, and fever, sensitivity to the light. Diagnosis is made through history, physical exam, and a lumbar puncture. With this, we can frequently determine if it's viral or bacterial. Viral meningitis is typically treated with symptom management and can usually go home. Bacterial meningitis requires rapid antibiotics and admission to the hospital. There are several things you can do to decrease your risk. Getting vaccinated and making sure they are up to date will avoid many of the more dangerous manifestations of meningitis. Washing your hands and good hygiene will help decrease the spread of illnesses, especially viruses, and potential for meningitis. Also, don't share items that can easily transmit infections, such as cups, utensils, phones, etc. Finally, if you are immunocompromised, pregnant, or at high risk, do your best to avoid people with concern for meningitis or signs of illness. If you have symptoms or concern for meningitis, get checked out right away. We can't prevent all infections or cases, but we can take steps to decrease that risk. I'm Dr. Ryan Stanton, and that's what's going around.